My name is Jessica Burden, and I am here to present to you my senior capstone project about early sepsis recognition in the emergency room. I'm delighted to have with me today three of my very own ER nurses here at Northside Hospital. We have Sarah Putzer. Hi. Nicole Ward.
Hello.
And we have Jared Ford, who's behind the camera on today. So first I'm going to talk about objectives. First, we want to identify the importance of recognizing patients that meet sepsis criteria in the emergency department. We also want to recognize the importance of utilizing initial resuscitation guidelines, incorporate the Sepsis 6 care bundle when treating patients that meet sepsis criteria, and place an emphasis on the importance of early antibiotic therapy. What is sepsis? Sepsis is a life-threatening condition that is characterized by systemic inflammation in response to an infection. Signs and symptoms of sepsis include fever, chills, altered white blood count, increased C-reactive protein, tachycardia, altered skin perfusion, and decreased urinary output. Who is at risk? The aging population, immunocompromised patients, patients that use increased life-sustaining technology, and patients with long-term use of indwelling catheters. Also, some other people that are at risk is people that have PICC line placed, patients that present also with wounds on their sacrum, and also you have to be concerned about the very young and the very old. Identifying the problem. Without early recognition and identification of patients with sepsis, these patients can rapidly deteriorate. I've seen many patients come into the ER, and if we don't catch it quickly in the back, they end up on life-sustaining things like they're intubated. They can also be on things like low-fat drips to sustain their blood pressure because the sepsis just destroys their body. Sepsis is the leading cause of death in hospitalized patients, and sepsis caused over 34,800 deaths in 2007, and it remains the leading cause of deaths in non-cardiac intensive care units. What is the rationale behind me wanting to enforce early sepsis recognition in the emergency room? It reduces mortality rates for people that have been identified as having sepsis or meeting sepsis criteria, and it also is utilizing standard order sets, which reduce sepsis mortality for more than 4,300 patients in the ICU. Also, implementing initial resuscitation guidelines or nurse-initiated guidelines, which we have here, decreases the length of stay for patients that were treated early, which in turn, saves the hospital money. Identifying sepsis. Basically, this is just a diagnostic criteria chart for patients that present with sepsis, and you can just look over that and you can kind of see what patients present with when they present to the ER with sepsis-like symptoms. If we were to put this into a charting system, we could say if a patient meets 2 or more of these criteria, we can work them up as possibly having sepsis. Identifying severe sepsis. Signs of tissue hyperperfusion includes the following. The patient may be confused. Their vital signs may indicate that they're hypotensive, have tachycardia. They may be thrombocytopenic. They also may have increased respiratory rates. Their O2 sats may be low. Also, another thing to keep an eye on is your patient's urinary output when they're in the emergency room. I think oftentimes we get so busy, we put in a folder, but then we don't look at how much that patient is excreting with their urine output. Also look at if they have any decreased bowel sounds, and then monitor their liver enzymes. Evidence for change. The severe sepsis campaign guidelines incorporate bundles or a core set of recommendations to assist in the management of sepsis. Protocol-based resuscitation guidelines have been shown to decrease mortality rates in the ED with patients presenting with septic shock, and should be initiated with the first signs of sepsis-induced hyperperfusion.
This is Sarah.
Studies have shown that ED personnel have been resistant to incorporate the care bundles of sepsis patients.
This is CDU.
Patients that present to the ED with acute MI or stroke symptoms often receive higher acuity levels during the triage process. but sepsis patients are oftentimes getting lower acuity numbers because it is harder to detect in some patients.
50.
Shauna wants to give you a report on a patient.
It's sepsis and you know it. This is the adult sepsis management pathway, and this is basically what St. Hilary's teaching hospitals use when they identify their septic patients. It is on paper, which is not really very friendly here in this day and age, but it breaks it down to where if a patient presents with certain things, you can check the box, and then if they have those general signs and symptoms like an increased heart rate, increased respiratory rate, if they meet 2 or more of those criteria, then within the first hour of diagnosis, all nurses need to have these things completed, such as the lactate, first round of antibiotics within the first hour, 2 large bore IV accesses, blood gases, chest x-rays, blood cultures, which you're going to draw 2 sets before you start antibiotic therapy, and then you're going to monitor the blood pressure and make sure the oxygen level is within normal range as well. Nursing interventions. We want to identify patients that meet sepsis criteria during the triage process. This is the golden hour when patients present to the ER with sepsis blood criteria. We also want to initiate the fluid resuscitation guidelines based on nurse-initiated guidelines. And here at the hospital, we do have nurse-initiated guidelines. We don't have to have a physician order for that. They're already incorporated into our system, and that is what is the beauty of early identification of sepsis in the emergency room, is that nurses can jump on this early. We also want to utilize the Sepsis 6 care bundle to expedite the care for the patient and then administer that first round of antibiotics after blood cultures have been drawn within the first hour of identifying the patient. The initial fluid bolus should be measured at 30 mL per kilos, and then the following tasks should be completed within the first 3 hours. Measuring the lactate, obtaining the blood cultures as I said before, and then administering that broad spectrum antibiotic. And then a care bundle is designed to ensure that all tasks are carried out at a specific time and place. The Sepsis 6 care pathway is comprised of the following. You're going to do oxygen therapy, fluid resuscitation, measurement and monitoring of urinary output. You're going to draw blood cultures, complete antibiotic therapy, and then make sure you have a lactate, a hemoglobin, and routine blood monitoring tests drawn. The importance of early antibiotic administration is that each hour delay in administering empiric antimicrobials is associated with increased mortality rates. Antibiotic administration should not be delayed, but administered first within that first hour of sepsis recognition. An appropriate regimen should include 1 or more drugs that have activity against the likely pathogen. And here's my conclusion. Early recognition and education are the key components needed to identify patients that meet sepsis criteria. The key to having a successful sepsis program is education and being able to implement the goal-directed therapy guidelines within 1 hour in the emergency room. The goal is to implement nursing bundles that are designed to help nurses and physicians determine if the patient meets sepsis criteria. And here are my references.